Or someone you know been feeling different lately, with mood swings, a fast heartbeat, losing hair, and losing weight without knowing why? Imagine waking up one day, and everything seems to be changing in ways you didn't expect. We want you to come along on a journey where everyday life turns into something unusual. We're going to explore why these changes might be happening, and your thoughts could be really important. Have you or your loved ones felt these things? What do you think is causing it? Share your ideas as we tell a story that might connect with your own experiences. Sometimes, stories can help us understand things better. Are you excited to uncover this mystery with us? Tanya, a cheerful and healthy school teacher, spent her days spreading knowledge and joy to her students. Life was good until one day, she began to notice some unusual changes in her body. At first, it was subtle mood swings that seemed to appear out of nowhere. She'd go from happiness to feeling jittery and nervous, leaving her puzzled. Soon, other symptoms joined the mix. Palpitations became a regular occurrence, making her heart race unexpectedly. Tanya, who once boasted a thick, luscious mane, now found herself dealing with hair fall, and her weight started to drop without any effort on her part. These sudden transformations left her concerned and prompted a visit to her general practitioner, GP. The GP, recognizing the need for a specialist, recommended Tanya to see an endocrinologist. Driven by the desire to understand and address these health changes, Tanya followed her GP's advice and scheduled an appointment with the endocrinologist. As an experienced endocrinologist, I took the time to carefully assess Tanya's symptoms. Listening to her concerns, I decided to conduct a series of tests to delve deeper into the root cause of her mood swings, palpitations, hair fall, and weight loss. Blood tests were ordered to measure thyroid hormone levels, including thyroid-stimulating hormone, TSH, T4, and T3. The results painted a clear picture. Tanya was dealing with hyperthyroidism. Her thyroid gland was overactive, producing an excess of thyroid hormones that were affecting various aspects of her health. The diagnosis provided clarity, explaining the array of symptoms she had been experiencing. Hyperthyroidism is a condition in which your thyroid creates and releases more hormones than you need. This is also called overactive thyroid. The main hormones your thyroid makes include triiodothyronine, T3, and thyroxine, T4. Hyperthyroidism can affect your entire body and is a condition that needs to be treated by a healthcare provider. Located at the front of your neck, the thyroid is a butterfly-shaped gland. Glands are organs that can be found all over your body. Some of your glands create and release hormones, substances that help your body function and grow. The thyroid gland plays a big part in many of your body's main functions, including regulating your body temperature, controlling your heart rate, and controlling your metabolism. When your thyroid gland is working correctly, your body is in balance, and all of your systems function properly. If your thyroid stops working the way it's meant to, creating too much or too little thyroid hormones, it can impact your entire body. Hyperthyroidism and hypothyroidism are medical conditions that both have to do with the amount of thyroid hormone your thyroid makes and releases. The difference is how much. When you have hyperthyroidism, your thyroid is overactive and produces and releases too much thyroid hormone. In the medical world, the prefix hypo - means low or not enough. When you have hypothyroidism, your thyroid is underactive and doesn't make and release enough thyroid hormone that your body needs. Anyone can have hyperthyroidism, but it's more common in females. Hyperthyroidism is relatively rare. Approximately 1% of people in the United States have hyperthyroidism. There are many symptoms of hyperthyroidism, and they can impact your entire body. You may experience some of these symptoms and not others, or many of them at the same time. Symptoms of hyperthyroidism can include rapid heartbeat, palpitations, feeling shaky and/or nervous, weight loss, increased appetite, diarrhea and more frequent bowel movements, vision changes, thin, warm and moist skin, menstrual changes, intolerance to heat and excessive sweating, sleep issues, swelling and enlargement of the neck from an enlarged thyroid gland, goiter, hair loss and change in hair texture, brittle, bulging of the eyes, seen with Graves' disease, and muscle weakness. Medical conditions and situations that can cause hyperthyroidism include Graves' disease, thyroid nodules, thyroiditis, and consuming excess iodine. Your healthcare provider can diagnose hyperthyroidism in several ways, including a physical exam of your neck, blood tests to look for high levels of thyroid hormone in your body, and imaging tests to look at your thyroid. If you're experiencing symptoms of hyperthyroidism, your healthcare provider may check your thyroid, eyes, heart, hands, and skin during a physical exam. Your healthcare provider may take a blood sample to look for high levels of thyroid hormone. Taking a closer look at your thyroid can help your provider diagnose hyperthyroidism and the possible cause of it. Imaging tests your provider could use to examine your thyroid include the radioactive iodine uptake, RAI. How is hyperthyroidism treated? There are many treatment options for hyperthyroidism. Depending on the cause of your hyperthyroidism, some options may be better for you. Your healthcare provider will discuss each option with you and help you determine the best treatment plan. Treatment options for hyperthyroidism include antithyroid drugs methimazole or propylthiouracil. These drugs block the ability of your thyroid to make hormones. They offer rapid control of your thyroid. Radioactive iodine. Radioactive iodine is an oral medication that your overactive thyroid cells absorb. The radioactive iodine damages these cells and causes your thyroid to shrink and thyroid hormone levels to go down over a few weeks. This usually leads to permanent destruction of the thyroid, which will cure hyperthyroidism. The amount of radiation delivered by this medication is different from the amount used for the radioactive iodine uptake, RAIU, test and scan for diagnosis. Most people who receive this treatment have to take thyroid hormone drugs for the rest of their lives to maintain normal hormone levels. Surgery. Your healthcare provider may remove your thyroid gland through surgery, thyroidectomy. This will correct your hyperthyroidism, but it will usually cause hypothyroidism, an underactive thyroid, which requires lifelong thyroid supplements to keep hormone levels normal. Beta blockers. These drugs block the action of thyroid hormones on the body. They do not change the level of hormones in your blood, but they can help manage symptoms like rapid heartbeat, nervousness, and shakiness that are caused by hyperthyroidism. This treatment isn't used alone and is usually paired with another option to treat hyperthyroidism over the long term. Doctor, how long does it take to treat hyperthyroidism? The amount of time it takes to treat hyperthyroidism can change depending on what caused it. If your healthcare provider treats your condition with antithyroid medications, methimazole or propylthiouracil, your hormone levels should drop to a healthy level in about 6 to 12 weeks. Though you may need to wait to be scheduled for thyroid surgery, thyroidectomy, this is a very effective and definitive way to treat hyperthyroidism. It's considered a permanent solution for hyperthyroidism. Doctor, are there any risks to hyperthyroidism treatments? With most treatments, there are also risks of side effects. It's important to talk to your healthcare provider and weigh all of the advantages and disadvantages before deciding on a treatment plan. Some of these risks include medication side effects. The two medications that can treat hyperthyroidism are methimazole and propylthiouracil, PTU. These drugs can cause several side effects. One rare side effect that affects less than 1% of people is potential liver damage, which may be permanent in the case of PTU. Another rare, less than 1%, but serious side effect is agranulocytosis, severe drop in white blood cell count. These side effects can happen to people of any age. In pregnant people, this medication can pass from parent to the fetus through the placenta. This could cause hypothyroidism or the development of a goiter in the fetus. Pregnant people are closely monitored because of this side effect. There's also a possibility of an allergic reaction to these medications, radioactive materials. Whenever radiation is involved, there's a possible side effect of cancer. Currently, there's no link between using radioactive iodine to treat hyperthyroidism and developing cancer. This is considered low risk and unlikely. One risk that is known is between a pregnant or breastfeeding person and their baby. You shouldn't take radioactive iodine while pregnant or breastfeeding because it can affect your baby's thyroid gland. Sometimes, you can lose sensation in your mouth after radioactive iodine, RAI, therapy. This is common. But don't worry, even though it can last for up to a few months, the sensation does come back to your mouth over time. Surgery. There are always certain risks linked to surgery, like infection and bleeding. Surgery is generally considered a very effective treatment for hyperthyroidism. In rare situations, complications like paralysis of the vocal cords, inability to speak, and damage to your parathyroid glands can happen, which results in low calcium in your blood. After treatment, you'll most likely need to take replacement thyroid hormone for the rest of your life. This is because some of these treatments, especially surgery, reduce your thyroid hormone levels to very low levels or eliminate this hormone by removing your thyroid. You'll need to reintroduce the thyroid hormones back into your system by taking regular medication. Doctor,